So Manrina, I'm going to dive straight in. Tell me, why dentistry, why teeth?
So when I was at school, I wanted to be an actress. I started studying theatre studies, history and maths at A-level, getting ready for my theatre studies degree.
Yeah.
And my headmistress at school actually pulled me aside and said, "You're very good at science and you're very good at art. And did you know a way to combine them is with dentistry?" And initially I was like, "Oh, gross, I don't want to do that. I want to be a famous actress." But I went to shadow a dentist and see what it was all about. And actually I thought, oh, this is really interesting and something I'd like to do. So then I changed my A-levels to do maths, chemistry and biology, and then applied to do dentistry.
So in your type of clinical work, you do a lot of smile makeovers, your transformations are amazing.
Thank you.
So what got you into doing kind of smile makeover industry?
So when I was at dental school, then we were made aware that there were so many different routes that you can take within dentistry, and I think that's what's so beautiful about it. That, you know, if you like doing sort of intricate work, you can become an endodontist. If you like the blood and gore, you can become an oral surgeon. And I was always interested in making things pretty and liking things looking nice. Cosmetic dentistry wasn't really a thing in the UK back then. You know, I graduated in 2002, so there definitely weren't any qualifications in the UK. All my education had to be in the USA. But what happened was, when I was doing my VT training, which is that DF1 or something?
Yeah, DFT now. Yeah.
DFT now, and so this advert came out for the job for the first dentist at Harvey Nichols, which is obviously a luxury.
You're the first female dentist at Harvey Nichols and Harrods as well.
Yeah, that's right, yeah. And so all my friends were like, "Oh my God, Harvey Nichols dentist, Manrina, that's you. You need to apply for that." And I was very underqualified because I was in VT. But I thought, you know what, you've got to try, and if you don't try, you don't know. So I applied for this job, and fortunately I got it, and that's how my career in cosmetics started.
Fantastic. So anybody who wants to go down your line,
Yeah.
what would you advise them, kind of courses or?
Yeah. So there's some really good academies and institutes that you can obviously get involved with, like the British Academy of Cosmetic Dentistry.
You're a director there, right?
I was, yeah. So I was, once I was in the cosmetic field through my jobs in Harvey Nichols and Harrods, and working at Lundosler, which was the first cosmetic dental spa in the UK and the first sort of clinic of its kind. We started getting involved with the American Academy of Cosmetic Dentistry, and then with the British Academy of Cosmetic Dentistry that had only just come about around that time. And so I started off as a committee member because I was a very young dentist. And then as I worked my way through the committees, then actually the president at the time, Tif Qureshi, said to me, you know, we really need you on the board. You should come on the board.
Amazing.
The BACD, unfortunately, is a very male-dominated environment.
Yes,
so the board was all men until I came onto it, and now it's all men again. And actually, even at the conferences, you know, it's 80% male. There's not very many women there, and it's not very well represented with females.
Why do you think that is?
I think it's because it's quite a lot. So going back to your original question of how do you become a cosmetic dentist, it's not something that you're taught at university. It's something that you have to take a lot of effort to go out and learn. And it's not the easiest thing to learn because there's not an obvious career pathway. So it's not like a perio or endo where you can just go and you know, at the end of it you're a cosmetic dentist. Certainly when I was learning, I had to do all my studies in America. So I did my occlusal studies in Florida with the Dawson Academy, and sadly, you know, Pete Dawson left us this week, and also with the Rosenthal Institute and at the New York Dental Institute was where I did most of my studies, and so I think it was a lot of effort. Like, it meant me going out and taking these courses. I was spending sort of £15,000 a year on education, which back then was a lot of money, and even now it's a lot of money. And also you're kind of out of your comfort zone. And I was really fortunate that I had these great mentors and people that really supported me and helped me through my career. But I think if you didn't have that sort of support, then you'd be quite nervous about where things can go really wrong. Like, things can go a little bit wrong with a filling, but they can go really wrong wrong with a smile makeover when you don't know what you're doing. So I think possibly women, we're more sensible, and so maybe they get slightly intimidated by that sort of process and think, you know what, I'll just refer that out because maybe, you know, I don't want to take the risk. Maybe men are more prone to taking risks, and so maybe they just go for it and kind of like go down that path, and also maybe more driven to take these courses and push themselves further, rather than women who may say, oh, you know what, I'm okay as a general practitioner. I mean, I don't know, and I hate to generalize, but that seems to be the sort of reaction or answers that I'm getting when I ask people about it.
Do you also feel that there are a lot of accomplished female dentists, but they're just not putting themselves out there?
Yeah, so if we look at why potentially people put themselves out there, and I can use the British Academy of Cosmetic Dentistry again as an example. Being a director or being on the board of directors for the Academy was great, and I really liked using my influence to make a difference, and also to inspire other people in their careers. But it's an unpaid position, and it takes up a lot of your time. And I had my committee that worked with me and helped me with things, but you know, it meant monthly meetings, and we were always messaging each other, and we always had a lot to do. And then with it comes some prestige, being like, oh, I'm a director of this academy, but you've taken up time and you're not getting paid for it. So I guess you've got to want the prestige enough to bother doing that. And I wonder again whether it's more men who are wanting to do that. Yeah, whereas women, you know, maybe we are, you know, doing well in our careers, but maybe we don't need to tell everyone about it.
So one question I ask all of the dentists is about stress.
Oh, yeah.
Okay, so this is one of the most stressful professions out there.
Yeah.
How do you manage the stress, and what do you find most stressful?
So I have a really good work-life balance. I work 3 days a week and I'm off for 4 days a week, and I've done that. I think that's the right balance, and I've done that for the last 10 years. So actually by Monday night I really look forward to coming to work on Tuesday, and by Thursday I'm done and I'm good to take my 4 days off. So I feel like those 3 days when I work, I'm really happy to be here. I feel like I'm really productive. I'm really excited to be here. I can give my patients, you know, 110%, and for me that works. I don't know that if I worked extra days, if I would even make any extra money, because I feel like this is the right balance for me to be at my most productive. Also, it's really good at handling stress, because I have a lot of time to de-stress on those 4 days. There's no doubt that the 3 days that I work, you know, my eyes get dry and my back gets tight, you know, my mind is racing all day, and it takes me about half an hour after I finish work. Like I'll usually walk home from work just so I give myself that time to slow my mind down, so I'm able, when I then get home, to have a conversation. And also typically I work out in the evenings after work, so I'll work out and then I'll walk home. So I get my workouts in, I de-stress, and so I have my 3 sort of long days where I get work and working out done, and 4 days to kind of chill and see family and do whatever else I want to do in life.
Do you have any sort of like a mental wellness routine? So a lot of people are into that now, like meditation, yoga, breathing, any of that?
They are. I would really love to meditate, and I talk about it often. And I've definitely been through phases in my life where I have meditated, that's a word, but I don't at the moment. So for me, I think it's working out regularly. I think that's what keeps me, maybe that's my meditation. That's how I keep my back in check. If I don't work out regularly, I start getting backaches, and my back gets really tight. And so I guess for me it's exercise. I don't have like a secret formula, sorry.
Sorry guys. So talking about stressful things, social media. So you don't only have one page, you have 2 pages.
I do.
How do you maintain both pages? And you're active in both of them. So you've got your personal one and your dental one.
So I don't find them stressful. I really enjoy them. So my social media, my Instagram all started with my personal page, so Manrina R, and that's been around for ages. And that just grew really organically, because I guess, you know, people I think people saw that I love my page. Like for me, it's like a magazine of my life. So I'm like, oh yeah, there's this picture, I did this, and oh, let me tell you about that. And equally, I'm that person who, when I do something, I love telling all my friends about it. Like, you know, I don't bake, but if I was to bake a cake, I would bake one and take a picture and then WhatsApp it to everyone and be like, hey, look what I just baked. And my Instagram account gives me a chance to do that to so many more people who actually want to see what I'm doing in my life, you know, who care about it and who respond to it. And so for me, I really enjoy that, and I think they do too, and that's why they follow my account. So what I started doing was about every 10 pictures on my personal account, I would start posting teeth. And every time I did that, I would get like 5 of my followers contacting me saying, oh, you know, I want this done or that done, can I come and see you for my teeth? And so I was like, okay, that's interesting that's the way that this is happening. And then I realized, I mean, that was, you know, about 2 years ago. And so Instagram was big then, maybe not as big as it is now. Yeah, it's really grown since. And so then I thought, okay, there's an opportunity here and I should start posting more teeth. So at the time, my Instagram was just about having fun. It wasn't about business at all. So I contacted, I don't know if I contacted the GDC or my Indemnity Society. I think it was my Indemnity Society, and asked them about if it was okay for me to be using this personal page for my dental pictures. And they said that they don't actually have anything written about it at that time, like as yet, but personally, they think it's inappropriate to post pictures of teeth or my work next to pictures of me drinking or on holiday. So they were like, to be safe, I would split them up. So about 2 years ago, I started Dr Manrina Rhode, and that's where that came from. And now I have them both going. So I think initially, Dr Manrina Rhode was a bit of a challenge because it was like, oh, it's teeth, and I don't know how really to make this interesting. But I think as people started finding my work interesting and commenting and messaging me about it, then I got into that as well, and now I love both pages.
Because within 2 years, you've got just under 20,000 followers. So how do you think you made teeth sexy, basically?
And actually, there's more followers on my dental page than there is on my personal page. And my personal page is the one that everyone's always been like, that people know me for. So that's insane.
What percentage of your patients do you think you actually get from social media? Do you think it's a good marketing tool, or do you have other successful marketing tools?
So the majority of my patients come from Google. From our website, from our clinic's website. The second biggest percentage comes from word of mouth, from patient referrals, and then after that they comes from social media. So I get a fair amount of patients from social media, but at the moment the way the balance is, it's not that most of them come from there. But equally, I think it's a good tool anyway for people who have come in through other channels to actually look at my work, or to look me up, or to feel more reassured, or to tell other people about me. Because they'll build up my page, like often my patients will follow me, then they'll show it to their friends and family, be like, oh, this is my dentist, this is the work she's doing. So it's a promotional tool, even if it's not the first place a patient finds you.
So you get a lot of patients, or not a lot, you get some patients from social media, but do you find that those patients are different to treat than your general patients that you've already got a rapport with? Do you feel like the expectations are higher, or do you think it's relatively the same to manage them?
So I think that the beautiful thing about social media, so I'll give an example of a patient that I saw recently. She was a 35-year-old lady who came to me through social media and through Instagram. She found me on Instagram, and she'd never been to the dentist before. And because she'd been following me, and quite often they'll start following my personal page, and from there find my dental page, and then start following that. And they follow, and they watch, and they think about their teeth, and then they feel like, they're getting to know me, and then they trust me. And she was like, and then, I trusted you, and so now I'm here. And now she's getting her teeth done, and, it's great that she's come and we've addressed her issues and we're sorting that out for her. So for patients like that, which otherwise maybe wouldn't have got treatment, it gives an opportunity to find you and get to know you a little bit before they come in. And definitely the patients that come in through Instagram feel like they know me before they come in, they're like, hey Manrina, how was your holiday? Da, da, da. What's happening with your boyfriend? Blah blah blah. Like they know about my life, and that's lovely. I love that. Yes, they're like friends. Just to add another point about influencers and about Instagram, I think it's really hard to hide it. Like you could say, there's people with popular accounts, and then you look at their work, and it's not great. And so, the reason they're popular on Instagram is obviously because of the way they look, or that they're funny, or the things that they're doing, not because they do the most beautiful dentistry. So that the work is still on show. I don't think people are I don't know. I hope they're not photoshopping their work. I've definitely seen a lot of examples on Instagram of work that doesn't look great, and I thought, wow, why would you post that? But I think for a lot of people it really gives an opportunity for them to show how great their work is, and certainly for my colleagues who I follow on Instagram, I feel really great. Like when I look at their work, I think, wow, so many dentists doing such great work out there, and equally so many dentists not, and telling people about it.
Well, which one of the dentists do you admire most out there at the moment?
So there's Dr Floss, so Andrew Chandrapal.
Yes.
He does really beautiful composite restorations. There's Tif Qureshi. Obviously his cosmetic bonding, edge bonding is really beautiful. There's so many of them. Like most of them are BACD dentists, to be honest. And that's how I know them. But it's a pleasure to see the work that they're doing, because it's beautiful, and that they're good dentists who care about what they're doing.
Okay, let's move on to the rapid fire round. This is kind of very non-dental, but a little bit of dental, a bit confusing. Okay, I'm going to start.
Okay.
First word that comes to mind when I say teeth.
Wet.
Suction.
Ness.
Wedding.
White dress.
Okay, what would be your spirit animal?
Black panther.
I like that. I can see that. So eyes, panda eyes. Best pizza topping.
Cheese.
Describe yourself as a teenager in 3 words.
Loud, ambitious, opinionated.
Your biggest fear.
Oh, okay. So I'm Sikh. So that's we say nirborn nirvad, which is out without hate and without fear. So I don't believe in fear.
She's fearless.
I would like to think so.
Are you Jat?
I'm not.
What are you?
Sunyani.
Fearless Sunyani.
And slap
you gotta do that. I'm Punjabi too. I'm Punjabi Jat.
Yeah.
The weirdest DM you have got on your social media. Weird, funny, strange.
Oh, I get really funny ones. I get a lot of funny proposals. I normally post them on my stories when I get them because they're so funny. Why you not reply me? I love you. I want to marry you. I want to spend my life with you, and you not reply me. And I'm like, should I just marry him? Like, really? I didn't know you wanted to marry me.
You're supposed to make people smile, not make people cry.
No, I don't want to make anyone cry, but I can't marry everyone.
No, it's true. Who, if you had a movie about your life, who would play you?
Oh.
You're into movies, acting.
Maybe J-Lo?
Oh, I like that. I can see that.
Yeah, I like her.
Yeah.
I think she's cool.
You said you would have loved to be an actress.
Yes.
Have you done any acting? Do you still pursue acting?
So I left acting after my dental degree because I went straight into this Harvey Nicks Harrods Lund Osler cosmetic dentistry glamour dentistry world, which was amazing. And obviously we did 10 years younger, and then Here We Came to London Smile, and we did Embarrassing Bodies, so there was like a lot of TV shows going on, which was kind of like acting. And then along the way, I got back involved. So basically what happened was I was on holiday in Mumbai, and some friends of ours, some people we were at a bar with, were making a Punjabi film, and they needed an NRI in the film to come. And so they were like, we're looking for this NRI, and I was like, which is a non-resident Indian, and I was like, I always wanted to be an actress. And so over these mojitos, we decided that I would play this character in their film. And so we signed a napkin, and I was like, this is my contract. Yeah, I'm going to do this film.
Too many mojitos.
But then I didn't realise that then, a couple of months later, they got in contact with me, and they were like, okay, we need to book your flights because you're coming to shoot this film.
Oh, amazing.
So that was amazing. So then I got to be in this Punjabi film called Love You Sonia.
Love You Sonia.
Yes.
Yeah, I think I've seen that film.
Yeah, it was in the cinema for a while, and I think, it's on like YouTube now. And then I kind of had this taste for acting. So then I got an agent, and then I did Amar, Akbar and Tony, which is a British Asian film, which is now on Netflix. So I was doing this all alongside dentistry, and it's really beautiful. The beautiful thing about dentistry is that it's so flexible. So firstly, I only work 3 days a week, so I could move my days around and work like 5 days one week, and then take the following week off or whatever, like when I was shooting. And for shoot dates, they'd be like, because I wasn't in every scene, like they'd be sporadic throughout the few months, and so I got to work my shooting schedules around my dentistry. So that was great, and then so I did that for a few years, and then I moved to America actually for 2 years, and pursued my acting career. I went into acting school and was signed by the biggest agency in the Southeast. I did some shows out there, so that was fun. And then I got back about 3.5 years ago to the UK, and now I've put acting down, like left it on the side.
Are you going to come pick it back up again?
I don't know. I don't feel to at the moment. Again, I think that social media and Instagram fulfills a big part of that for me. So I like to perform and talk and be on TV, and so I have my own little TV channel,
The Manrina
Show, which is the Insta stories on both my pages.
That's why you don't find it stressful.
I love it. I love sharing my life. So yeah, on Manrina R, I talk about the fun stuff I'm doing outside of work, and at Dr Manrina Rhode, I talk about the fun stuff I'm doing in work. I keep them separate, but I get to share what I'm up to, and I really enjoy that.
Thank you so much for being on the show with us, the Denfluence show. Now we're going to end with you nominating who you think should be interviewed next.
Oh.
So which dentists do you think are Denfluence worthy?
I think you should interview Joe Bansal.
Joe Bansal, does he have an Instagram page?
He does, the smile surgeon.
Oh yes.
He's very funny and a very good dentist, and I think that will make a really entertaining, interesting show.
Exciting. Thank you so much.